Hi guys, welcome to our live session. So today as our guest we have Dr. Krina and we'll be talking about puberty in girls and all the physical and mental aspects of the same. So we'll just wait for her to join in and we'll quickly dive into the session. Alright, so Dr. Krina is over here. We'll quickly invite her. If you have any other questions, please make sure to drop in the comment section and Dr. Krina will be happy to answer.
Hi, how are you doing?
I'm good, how are you?
I'm great.
Alright, welcome to
So,
Girls First. First of all, thank you so much for doing this with us.
thank you so much for inviting me and giving this opportunity. Thank you.
Wonderful, wonderful. So we are going to talk about a really interesting topic. So before we dive into the questions, first things first, please tell us something about yourself.
Okay, I am practicing homeopathy and also I am a nutritionist.
Yeah.
So, I deal with children as well as adults. So, both actually, basically, it is a holistic approach where you give medicines if required, or
Yeah.
else if counseling is, if things are done with counseling, then I provide counseling and nutritional requirements. It depends on how or what is patient's need. So, I act accordingly like that. I'm from
Wonderful,
Ahmedabad
wonderful.
and my practice is online.
All right, great, great. So, all right, so let's just quickly dive into the session and we'll begin with the first question. So, a very basic one, what is puberty and how can we understand it in the most simple terms?
So puberty is basically when a child's body transits into an adult body capable of sexual reproduction. That is, a girl matures sexually, and there are hormones released from brain towards the organs of girl, and vice versa. With even with boys it happens. But right now we are going to talk about girls.
Yeah.
So in that the like in ovaries it is released, so estrogen hormones are released. There are different type of hormones released which gives rise to all the physical changes and psychological emotional changes in the body
Yeah.
of a girl, which starts puberty phase.
All right, all right. And what are some of the major physical and maybe mental or emotional changes that a girl goes through during this time?
Yeah. So basically, physical changes, as we all know, that breast changes are the first sign which
Yeah.
breast birds are developed, and then it grows. So that is first sign which is seen. Then there are pubic hair development. Then underarms hair development is seen.
Yeah.
Then there is increased height. There is rapid growth spurt seen. So there is overall structure of the body changes. The shape of the body changes. You can feel the curviness in the body of the girl. There is increased fat cells. In boys there is muscles, muscular thing is increased,
Yeah.
while in girls there is fat cells. Sudden rise of fat cells are seen, so because of estrogen hormone.
Yeah.
So we feel that there is sudden change in uh, physicality of a girl,
Yeah.
and there is menses appear, menstrual cycle appears. Then there is vaginal discharge seen. which so this is basically a lot of changes, a sudden change
Yeah.
physically even, which is very tough for a girl who, a child, you can see a
Yeah.
child,
Right.
to see all of these changes, physical changes. Then on emotional ground, actually we don't see, in especially in India, where we are only considering physical things, like
Yeah.
if there is like periods aa gaye, so it is like okay, fine, that is the only sign which is seen,
Yeah.
or some physical signs. But
Yeah.
basically, what that child is going through emotionally is main concern.
Right.
Psychological, they become anxious.
Yeah.
They go in search of their self identity. They become self conscious. They especially they become conscious about their body,
Right.
because not everyone is going to go through that phase. Some are going
Yeah.
to lag behind, some are going to go fast. They will develop their physical thing faster, some will develop faster while some will not develop. So there the emotional changes are seen, comparison will come
Yeah.
there. Then there is a lot of self consciousness. There
Yeah.
is a uh, there is a lot of the rebellious behavior comes
Yeah.
in
Yeah.
their attitude. So there are a lot of changes, emotional changes also seen. That is psychological.
Right.
In there.
All right. So as we talked about the behavioral changes, so apart from the teenagers, if we look through the perspective of the parents, it's also very difficult
Yeah.
for them to see their young one
Yeah.
growing to a woman. So how can a parent, or maybe especially a mother for a girl, behave in a certain way or provide a certain kind of support, help the girl to deal with all these changes normally?
Yeah. So basically, what I have seen is that actually a child,
Yeah.
if from a healthy background, from a sane parent, very well educated parents who knows everything,
Yeah.
they suffer less than the parents. I want to say they don't know, they know, but that their behavior is controlling.
Right.
They are not able to accept it. I feel that as a mother, if
Yeah.
you have been through that condition, you know everything. What was the that condition is. Maybe don't know everything medically, but you still know what are the emotional changes during that time.
Right. Right.
So being a parent of a girl child, you should know that what she must be going through.
Exactly.
Basically, for a girl, the biggest thing is that she the menstrual cycle which begins, that,
Yeah.
and all the behavioral problems or hormonal issues around the menstrual cycle is biggest for a girl, which is not
Right.
seen in boys. So, and
Exactly.
also estrogen hormone is basically, research says that estrogen
Yeah.
hormone gives rise to depression, gives rise to lot of behavioral mental health problems in girls,
Okay.
while
Yeah.
testosterone in boys doesn't give. Research has
Okay.
done that. So they
Okay.
don't face that much which girls go through.
Right.
So girls go through a lot of things.
Yeah.
So, as a mother, I would say that first is that you have to stop controlling your child
Yeah.
for everything. There should be boundaries, but there should not be like over controlling that. Abhi matlab, it's like they'll be in a romantic relationship. All that, it is biased, preconceived notions which parents have in their mind.
Right.
If they are
Right.
going to start talking, especially in school, they will be just 11, 12 years, and if they are mingling with boys and all that stuff, though parents become very conscious. They do.
Yeah.
Some parents do allow. They some give lot of freedom, while
Yeah.
some don't give freedom. They'll be like suspicious towards them.
Right.
So all this creates that that problem
Yeah.
in the girls. They feel insecure. They feel that
Yeah.
my parents are not trusting me. Then
Yeah.
there is again a peer pressure,
Right.
because what that everyone is going through this. Their whole class is going to like, they'll be one or step behind, but still they are going to go through this. So there will be peer pressure. Everyone is going, so there will be like competition will be more high. There everyone is going through this nervousness and anxiety, and about knowing about themselves. Self identity is the basic. They'll be going through this.
Yeah.
So as a parent, I feel that you have to make your child understand everything. You have to stop criticizing them for everything. like they'll be exploring their body, everything. They'll be
Yeah.
exploring their sexual identity. They'll be exploring new clothes, new what they, they'll, some will be like become very feminine. Girls will become
Yeah.
more towards more feminine, and they'll be like, I want to wear this, and their choices will develop for
Right.
themselves. So everything at that time, as a parent, you have to give them liberty, let them do their choices. Other thing is listening here. Like you have to listen rather than speaking, and rather than like advising constantly,
Yeah.
taunting. I've seen some parents, they just start that is the relationship literally becomes haywire between parent and girl child, because
Definitely.
the girl is going through emotional crisis, and in Indian parents they don't have this thing. They don't understand that what
Right.
are they going through. Girls are
Exactly.
going through. They'll
Yeah.
not understand and not accept it also. They
Yeah.
feel, and what will happen that girls will, they are high, they become secretive during this phase,
Right.
because they are going through a lot of brain changes and
Exactly.
psychological changes. So they'll be like, they'll become more mature. So they'll become more secretive, that I'll not share this, that. Like as
Yeah.
a child, they were sharing a lot of things, but now they have become like this. That causes a lot of friction between parents and child.
Exactly.
So
And
like,
that's
why
the
you are
point
not
where the relationship also goes like very,
exactly.
becomes a very toxic relationship between a parent and a child.
Yeah. And it happens, I have seen this between 13 to 16 years phase
Yeah.
is like that, where every parent has to go through this.
Exactly.
Because as a parent, we are not able to accept. There is no fault of a girl child. You should never, I don't know why they say that teens is rebellious. Not, it is not like that.
Yeah.
Because your behavior is making your child rebellious. You're
Exactly.
not giving that atmosphere to your child,
Yeah.
that home, that atmosphere where she feels safety, where
Ex-
she feels that I am safe here. That time in teens, what happens is that children, this, they want that they, I should feel safe. They'll
Right.
go towards love. They'll go towards affection, safety, and whoever is going to put that her down at
Yeah.
that time, she'll rebel. कि
Right.
why are you telling me everything? Why are you
Exactly.
doing this? So this is the thing which is happening. So this is completely normal. Parent has to understand this is hormonal. It is a puberty mind which is causing all of this. So
Exactly.
it is not just about physical thing, but also emotional changes, which I feel should be taken care of
Exactly.
more. Because even if a menstrual cycle has started, the pain of period is not causing a girl that much pain, which
Yeah.
that stigma and constant nagging behavior of parents, relatives, or school
Right.
people, that is
Even
causing
the
them more.
teachers, even the teachers, peers, and everyone.
Everyone, they don't because especially teachers should understand, but they also don't understand
They
this.
do. Yeah.
So that is the, but awareness is being spread.
Ex-
So now people are going, they are understanding. Education is being promoted so much. So even this is the thing that during India, people is like they explore in private everything, but
Exactly.
they don't, so they don't openly speak even at home. Whenever the thing this about private relationships, about
Yeah.
the sexual identities, anything related to sex, if it is coming, if it is coming on TV also, like people will change their channel and all that stuff.
Yeah.
So there is no
It's
openness
a
in
taboo.
family.
Yeah.
Yeah, it's a taboo actually.
Yeah.
So no openness in family, that is what I want to say. So what happens is this thing will cause a secretive, this thing will make a girl secretive.
Right.
She'll be more attracted towards her peers. So what will happen that now, if they are good like influence, then she'll learn good things, something like that. But and if they are not a good influence, she'll go towards drugs and alcohol exposure, all of this, or
Yeah.
other any behavior which is
Exactly.
harmful for her growth, for her
Exactly.
physical growth, for her career growth even. So there are
Exactly.
also cases saying that the child is very good while studying till some standard of the, but
Yeah.
But as soon as she enters teens, she suddenly goes down in her grades and she's not doing anything. But this is all psychological because a lot of
Right.
things is affecting her, and
Exactly.
parents are not able to heal them or whatever.
Yeah.
So, a lot of things as a mother, I feel that we have to be real with your child.
Yeah.
We show them whatever, like if you are facing anything, if you have done any if you have done anything wrong, then speak up.
Exactly.
So they come to know that yeah, mom is
Normal.
also doing wrong
Yeah.
things. So it's okay. There is nothing wrong. Don't be
Yeah.
that ideal parent,
Exactly.
great parent like that. Yeah,
Exactly. And I mean, while going through also, we come through a lot of things, a lot of changes, a lot of new aspects of life. And that
yeah,
obviously fascinates a growing woman, a growing girl. And
yes,
if a parent is not
yes.
really understanding or very open about talking about a few things, then definitely we find ways, to get information from
Yeah,
others.
of course, of course. See, now what has happened is like now things have changed because Instagram is
Yeah.
spreading a lot of good things. A lot of doctors are spreading awareness.
Yeah.
Then even Google is now through Google we can come to know a lot of research based
Yeah.
information,
Right.
which now children, those who are the teenagers, know that how to get that information right.
Yeah.
but
Right.
uh, but that also there should be someone at that time to guide them because their brains are immature yet. They are not at the peak level, that matured level.
Right.
They are very immature, so they
Yeah.
don't know what to do. They will divert easily, they get divert very easily. So
Yeah.
as a parent, I feel that you have to listen to them, you have to give them right advices, but don't control them. Just
Exactly.
show them the right paths, let them explore, and that way only they will learn.
Exactly. And that is a very good point that let your child explore. Don't just hold their
Yeah.
hand and take them everywhere along the
I
way.
will share one of my case here. Like I had she is my patient. Like
Okay.
whole family is the patient. So
Yeah.
she was like when 6 years old, she was my patient. Like
Okay.
then she entered puberty. Like since 6 to 7 years, she is my patient. She is still there. She still comes for her problems, asthma and everything. But during her puberty stage, she involved in a romantic relationship with a guy from her class,
Yeah.
and her mother came to know. So she called me up. First of all, they whatever happens in their family, they'll call me up, and she told me that this is in this thing. I just came to know through her mobile.
Okay.
So like she must have checked her phone.
Yeah.
Whenever she sleeps, she checks her phone.
Okay.
So I told. So first of all, what happened? The next day fight became. They fought because her mother checked her phone. So why
Yeah.
did you check my phone? You
Yeah.
don't trust me, all that stuff. So
Yeah.
I explained actually her mother that it's your fault, that you should ask her first. Like
Exactly.
because now exploring themselves, they have self identity.
Exactly.
They are they feel that now I am responsible person. Now I'm a different person from my parents. It's
Yeah.
like that. All is developing. But parents don't know that. They just
Exactly.
want it. Why did she do this? Is wrong. How can my daughter do this? How can my daughter do this? Like,
Yeah.
I had never expected her to do this.
Yeah.
She's just 12 years old. I mean, like that. I know it
Yeah.
is 12 years, but now the girls and boys are maturing too fast. So
Exactly.
it's like
Definitely.
they are, everything is puberty has come early,
Yeah.
and everything is happening. Their brains are maturing also too fast,
Yeah.
especially in all this fear. So they are like, so at that time I had to counsel my patient a lot, her parent especially, that all this thing is normal and all that stuff. Because then also she was not able to accept it, that how can this happen? And
Exactly.
their
Safety is
relationship
key.
literally,
Yeah.
yeah. So their relationship literally became bad, and they after that there was sudden change. See, both of them were emotionally unstable, and they felt that both were, that friction came in between them. And
Exactly.
this thing I have seen in many patients,
Yeah.
that they don't understand this thing. There is no acceptability.
Yeah.
Mother has no acceptability that my child is doing all this stuff, but
Yeah.
they have to understand this is normal. This is
Exactly.
their hormones are making them do this, not they are doing
Exactly.
hormones.
Yeah. Definitely. Definitely. There's so much of hormonal rush and adrenal rush that
Yeah,
they do it. And even like
Exactly.
in today's world, children are exposed to a lot of things as compared
Yeah.
to like earlier. So yeah, it's
Yeah.
pretty much normal if we like think like that. But yeah, as a parent,
Yeah.
it's
Yeah.
obviously very difficult to sort of accept that their child is doing something like that.
Exactly, exactly. And I know when I was 12 years old, didn't know anything. But
Exactly.
now, sudden change, that there is a revolution.
Yeah,
And so you have to change with revolution. See, now I can't expect my son to be like, when I was 12 years old. It's not
yeah,
possible.
definitely.
They are growing fast and you have to grow with them. Or else there will be such frictions and, all these problems. And there is a lot of raging hormones, you can say that. So there is a lot of irritability, anger issues in
Yeah.
this teenagers. So
Yeah.
what happens is that due to this anger issues, there is a lot of friction seen because they don't listen to parents, and
Yeah.
parents will they are not listening to, they are insulting, your child is insulting me now,
This is
she is
I've seen in a lot of parents that whenever their child is not, or maybe like just even tries to disagree or tries to put up their opinion, the parents feel that, oh, the person like my
yeah.
child is respecting me. How can they do that?
Exactly.
Yeah.
Exactly. So because what is happening till 10 years, your baby is like, it's like my child is following me, everything. You are controlling you. See,
Exactly.
right. I counsel my patients since, their baby is 2 or 3 years old. I tell them don't control them,
Yeah.
but parents will do that.
Exactly.
And it's still, yeah, it's so 10 years, till 10 years they are controlling constant, they'll say sit down, eat now, sleep now,
Yeah.
and suddenly brain has developed, an individual brain has developed in 11 or 12 years, because of puberty. There is sudden change, will be sudden, everything will be changed.
Yeah.
So parent can accept that. They say, I am telling you to sit, you are not sitting, because
Yeah.
the girl feels that why should I sit now? I don't want to sit now. Why
Yeah.
are you forcing me? So
Yeah.
this is the problem. The parents are forcing children to do things which they
Yeah.
don't want to.
Yeah.
So that is basically basic reason why children have become rebellious. They
Right.
start hiding things.
Yeah.
They start, they trust more on their friends.
Yeah. Than their
So
parents. Definitely.
any parents, yes, definitely. They share everything. They do, like, there is a lot of talks. Good, like, I had recently seen a parent had discussed with me. There was COVID going during
Yeah.
COVID times. The friends were not meeting, but there was the parent told me that they used to talk. The boy is around 12 years old only, yeah?
Yeah.
13 or 12 years old. But they used to talk whole night, two or three
Okay.
friends,
Yeah.
the girls and one, like, he himself. So
Yeah.
then the parent was telling me those two girls are only like that.
Yeah.
Though, because my son is so naive, he doesn't know anything, and they are. So I told it's nothing like that. They all are changing. So
Exactly.
girl matured faster. That does not mean that your son is not talking, or just they are manipulating him. So
Yeah.
like
Yeah.
that, this thing also happens, that
Yeah.
parents
Definitely.
start fighting among themselves, that
Yeah.
your girl child is doing this,
Yeah.
your boy child is doing this. Now
Exactly.
they
There's a
are,
problem in your child only. My child though is very Sida Sada.
yeah, exactly,
Yeah.
exactly. So all this stuff starts with teens, puberty only. Before that, nothing is that,
Yeah.
no problems. But after this, all of the things changes.
And I think parents also sort of like take a step back in accepting the fact that their child also has an individual life now, a brain to think about, and that's when the changes start to sort of hamper them. That why
Yeah,
is the
exactly.
yeah,
And I feel that this is not just to teen, your child till your child, I mean child or adult turns into, like, grows till 40, 50 years, still, the mother thinks that
right,
मेरा बच्चा बच्चा है अभी तक, it's like
right,
this
yeah,
control. That is Indian society. They
right,
want things like that, but now it is not happening. They don't change with it. That is
yeah,
what is the main problem. And they want children to change.
exactly.
Still, some of them do that. There are children who do that they change according to their parents. But every time it is not possible,
It is
because
not
they
possible.
outside world, while
Yeah,
their parents are still, behind. Of
yeah,
course, like I be right now, I know all of this, but my son will be knowing something else. So I have to accept it.
Right,
So
right.
I have to learn from him in future after
Yeah.
10 years because he will have his own mind. Right now I'll be teaching him, but after 10
Yeah.
years I have to, because so that is what you have to do it.
Right.
Yeah.
Definitely. And I think every parent needs to understand this one thing, that you need to walk hand in hand along with your child if you want to be their friend. Not just only saying
Exactly.
that I'm your friend, it won't satisfy.
So this is also good. I point like a friendship bonding with your child, your
Yeah.
teenager during this adolescence is most important. The
Right.
true bonding, not to
Yeah.
bonding to just know things about from them,
Right.
but
What is going
bonding.
on in your life? Yeah.
Yeah, don't do that. But bonding to know what child is going through,
Yeah.
uh, and what and so that she feels safe with you.
Yes. Yeah.
That yeah, that only my parent I can, they are trustworthy, and this is true because your parents are only first thing to trust on, because
Exactly.
they'll guide you. Like,
Yeah.
see, the recent case we have seen that Aryan Khan, Shah Rukh
Yeah.
Khan's son.
Yeah.
So no parent will teach or tell that go and have drugs. If he has taken or not taken, I don't know. But I'm just saying
Yeah.
that no one in all these cases, no one will tell. But what
Exactly.
happens is that the rebellious behavior, the friction between parents and all that stuff makes them go away. Or you have lot of freedom, lot of freedom. Like you can do anything. It's okay. I'm there. You
Yeah.
can do anything. I'm there. There are
But the
40
extent
parents on the
is
street.
wrong, I think. Like, it needs to be a very
Yes,
balanced sort of a relationship. Like, not also like
exactly,
a lot of freedom and not also like very controlling. It needs to be very balanced.
exactly, exactly. So that is there. So this is most important for this.
Yeah. So yeah, as we talked about a lot of emotional and mental aspects. So how does the mental health affects a girl, who's going through puberty and all these physical and mental changes?
Yeah, so see, whenever a girl goes through this puberty thing, there is basically mental health, as I said, their mental health is lot due to estrogen hormone. Their mental health is affected a lot. Lot
Yeah.
of cases have been seen of them going into depression.
Right.
There are a lot of cases where, due to emotional changes, no support from family,
Yeah.
there is inferiority seen
Yeah.
in peer groups,
Yeah.
because not all are going to mature same way. Then
Exactly.
look consciousness comes. Like
Yeah.
I want to be popular, and
Yeah.
it's like that because the those who mature fast and beautifully, that is the concept, that
Yeah.
this way, that should be there, this should be
Yeah.
there. They will be more popular
Yeah.
among the group. So those who are not, they'll go through a psychological change that I am feeling inferior.
Yeah.
Then there will be sleep pattern, circadian rhythm is affected. Their
Okay.
sleep pattern is affected, which can cause a lot of mental health issues.
Right.
Then gut issues, skin issues, a lot of things are affected.
Right.
Then there will be a lot of risk-taking behaviors seen in this girls, that there'll be audaciousness, they'll want to do a lot of things, they'll go for adventurous rides and everything on their
Yeah.
own, on their self, or like I want to explore this, I want to explore that. And if they are not able to do that, like if parents are not allowing, like if simple I say that, even if in school picnic they want to go, and if parents don't allow, they'll become rebellious, that why are you not allowing me to go alone,
Yeah.
why not
Yeah.
allowing? Because now what they are thinking, it is not about they are not allowing me, they are not allowing me to go alone, that
Alone.
thing comes in your mind,
Yeah.
that they don't trust me,
Yeah.
so they'll
They won't.
overthinking.
Yeah.
ex- Overthinking nature also comes. Pehle though they don't think only anything because they were child, but now
Yeah.
the abstract thinking, everything is, there is both spurts seen in brain also. There
Right.
is every sphere of body, there is both spurts. So what will happen is that they will be like, why they are not allowing me for all
Yeah.
of these things.
Yeah.
So now there is rebellious behavior. Some will go toward totally down. Some will become very rebellious.
Right.
So, all of this mental health is definitely affected in girls, especially as I say, because girls in Indian society, again, girls are dominated more. They are
Yeah.
taught to be like, you have to behave in this manner only. You have to do like this
Yeah.
only. You don't have to talk in this way.
Yeah.
So all of this due to society norms also, social culture,
Yeah.
girls are affected a lot.
Right.
So so their mental health is affected even this
Exactly.
way, because once they enter teens, they have to behave
In
differently.
a
They have to
certain
speak
yeah.
softly, do like this, sit properly.
Yeah.
Constant nagging
Yeah.
instructions are coming from
It's not
behind.
even from the parents, even from the society, like even from the neighbors, you
Yes.
see. Anyone can
And
come
even
and tell you something like, don't do this, don't do
yeah,
that. Yeah.
exactly. Which should be actually not tolerated by parents. At that time, parents have to come and speak for their children that it's okay.
Yeah.
But no one is going to speak. In fact, they will only scold the girl
Yeah.
that you have to do like this way only. You have to wear certain kind of clothes, wear this. But this is now problem is due to a lot of awareness and their own self, identity. They don't like it, so they will
Yeah.
become rebellious. So that
Right.
is what is happening. Yeah, so this is affecting their mental health. Some will
Yeah.
go into depression, like what is happening with me? They are not able to cope up the situation.
Yeah.
There are a lot research is saying that 10 years child is also going due to puberty, they are going into depression. Again, hormones have to play the role. It's
Right.
not due to just psychological something or pressure, but yeah,
Yeah.
hormones making them do this.
Exactly. Right.
That is what all of us has to understand. So this is the phase. Like there is a menopause phase where people don't understand women. Same
Yeah.
is the puberty phase where people don't understand girls.
Right, right, definitely. And as you talked about the thing that accepting their physical features also makes a lot of difference, that they feel insecure about themselves. And during the time
Yeah.
of puberty, obviously there's acne, there's pimple, there's a lot of things.
Yeah.
And there are few girls
Yeah.
who don't suffer through these things, and there are few who
Yeah.
suffer majorly from these things. So
Yeah.
how do
Exactly.
you sort of deal with that complex or that
Huh.
inferiority complex sort of something? So how to do that?
Yeah. So what is happening is first of all, that is what I'm saying, that parents have the major role to play in this.
Right.
Then their group, like friends, what they are making, they
Yeah.
have the major role, because if they are with someone toxic friends they have,
Yeah.
at this time I have seen that children wants to be with teenagers, like growing children wants to be with someone popular. They
Yeah.
want to be with, they are fascinated with popular group,
Yeah.
popular girls, popular boys who are, very
Yeah.
popular, very good looking, very
Yeah.
hi-fi types, very rich, who brings, they are bringing car in the schools, and there are
Yeah.
children who are
Yeah.
since they are bringing this car, they are coming. So they want to be in group of these people. But
Exactly.
this, or not all I'm saying are empathetic, but
Yeah.
many are not. They just do show off and all that stuff. And
Yeah.
uh, in this thing, the children become, this growing children become, they get affected, that they become conscious actually, that
Yeah.
now I don't have this thing. I don't have branded now. This just brands is also, you should have everything branded.
Yeah.
So like I don't have a branded purse. Then they'll go home and fight with their parents that
Exactly.
I
And even the
this
kids.
I
Yeah.
yeah. So this is what is happening, and because they want to be in that group of people, that they are they I want to be, I also want to be popular. They
Yeah.
can't be popular on their own. So what they will do is they will choose this people.
Yeah.
It's not that they can't be popular, but that is inferiority complex, that they don't believe in themselves. They feel that I have lacking I'm lacking something. They have insecurities, and that is also insecurity due to their parents or the environment they were living in. So
Right.
everything starts childhood only, all of this. So
Yeah.
during childhood only, if you change, then this will not happen. But it's okay if it is happening, then you can change later on also. But so look, good looking scheme is there. Like if there are good looking girls, very good looking scheme is there. Like they'll be more attracted to that,
Yeah.
and they feel that I am not having this thing.
Yeah.
So at that time, this is affected. They'll be like, so they have to avoid such things. They have to be happy with their own scheme. That whatever I
Exactly.
am having is I am happy. But actually, the role of therapist comes during this. The role of parents come during this
Right.
time. Because so emotionally immature girls won't, at that time they will not able to counsel themselves.
Yeah.
They will not able to make themselves feel better.
Yeah.
They are definitely going to go into this mud only, that I am not better and I have this acne, because society has only shown like that,
Exactly.
that
We have been conditioned in that way since the
yeah,
childhood. Yeah.
yes, that is that if you are having full face of acne, that means you are not beautiful.
Right.
You know that
Right.
concept. That is a combination, which is wrong. We need
Which
to
is
change.
wrong.
Which parents can change it by giving
Yeah.
constant support, constant confidence to their child, telling that what is right, and
Yeah.
apart from them giving advices. If you feel there is lot of acne, then what is the reason behind? Find the cause, treat
Right.
it. You
Right.
know, American like pediatric, they say that you have to constantly clean your skin,
Yeah.
like keep your skin clean because there is a lot of oiliness
Right.
develop. So wash thrice your face, then use cleanser and all that stuff. So,
Yeah.
but what we will do is we will not follow them. We'll bring that gargattu, all that stuff from
Yeah.
kitchen, apply
Yeah.
the multani mati, and I know this. That is horrible. So you have to use this. That is causing a lot of acne increases. That is pores in the skin increases. All that
Yeah.
stuff. That scars are left behind.
Yeah.
And so herbal things are good, but what needs like if there is need of a dermatologist, then you have to go to them.
Exactly. Nothing can
Get
satisfy.
your
Yeah.
Yes, you have to do that. So it is
Exactly.
simple. Even in homeopathy, we have this
Yeah.
medicines for skin. Good, if there is acne, then we can treat it
Yeah.
without any side effects. So, but there is not awareness. So this is again the problem. They don't want to take homeopathic also. They don't want to take allopathic medicines. They don't want to take homeopathic. They just want to do some gargattu kitchen में से उपचार. दही लगाओ, turmeric लगाओ, and that is why their skin is spoiled. And
Exactly.
but Bacha also goes into this all that stuff. Yeah, inferiority thing that yeah, after all this up, after applying all of these things, still I am not. You're not applying properly. What are you doing? You're not doing. Even their diet is not good.
Yeah.
Processed food, everything is just not at proper place. So things are
Right.
going to affect.
Right. And even in this, I want to add a point that even parents play a major role because they start comparing their kids to others. That उसको
Yeah.
देखो वो कितनी पतली है तुम इतनी मोटी हो रही
हाँ,
हो and all of that stuff.
exactly.
Parents also start unknowingly they do it, but they do it, and that actually hampers the mental health of a child. Definitely.
Definitely affects. It also affects their relations. If
Yeah.
that person is friend of for her, then
Yeah.
she'll start hating her. Jealousy will develop.
Yeah.
All that stuff. So their friendship is affected again. So all of this is a lot of parent counseling needed
Yeah.
in this thing. That there should be a awareness spread that what parents should do for their
Exactly.
for their teenagers. So there is definitely comparison done by parents, which is it is like they are going to do. It is since childhood they are doing
Yeah, definitely.
that.
They don't even
मेरा
understand that
बच-
there is something wrong.
Yeah, my baby it's less, your baby it's
Yeah.
more. At that time, children are not affected.
Yeah.
They are in their own world. But now, after puberty, they are affected. They feel everything. Their emotions have changed. Everything is over heightened. So they are affected. So it's like that.
Yeah. So, yeah, we have talked a lot about the emotional and the mental aspects. So, coming to the physical aspects of puberty, the needs of the body also changes. So, what are some of the
Yeah.
nutritional or the dietary changes that needs to be implemented during puberty?
Yeah. So first of all, I have seen in our recent generation is that they are giving a lot of processed food to children.
Yeah. Yeah.
Like processed food in the sense once or twice a week they need kurkure, they need wafers, they need this bakery items, and biscuits are their regular tea time habits. That morning or in afternoon you don't have any other option and try different type of biscuits and cookies and pastries and all that stuff.
Yeah.
But so that is causing a lot of health issues, hormonal issues also.
Correct.
Yeah, so hormones are triggered due to this, and PCOD. If a girl has a PCOD, then it
Yeah.
worsens due to this processed food habits.
Yeah.
So that should be actually changed. That first of all you have to stop, give less processed food to your children.
Yeah.
Then include a lot of iron for girls. Iron is most important because it increases blood volume and curbs the anemia, and also for skin iron is really important with vitamin C and iron. So if your girl is having a lot of acne, skin issues, or dull skin, then you can give a lot of vitamin C and iron together. Then protein is most important. It is a muscle building. So that is going to help in growth of a girl, a healthy growth of muscles, bones, and uh, overall body structure.
Yeah.
Then good fats, which is again going to develop their brain and
Okay.
skin and other organs like breast and all that stuff, all the other organs. So it is overall good fats are really important, like
Yeah.
walnuts, nuts, olive oil, which we should include in regular diet of a child, of a girl child.
Right.
Then again, carbs play a very good role. So complex carbs are very important because it has a
Okay.
lot of fibers. So it is going to help gut also, and also their growth, energy level increases. So and there is a growth spurts in
Yeah.
while puberty. There is sudden growth. So their appetite increases. So
Yeah.
what we do is we make 2 meals of a day.
Yeah.
Like in morning meal, roti, sabji, dal, and all that stuff. And
Yeah.
शाम को थोड़ा होता है. But whole day, if they'll be hungry whole day, they want
Yeah.
something or other. There are emotional changes, so they again want something. So what we
Exactly.
do is we'll give biscuits, we'll give this and that, wafers and all that, or fried items. Ghar pe fried item we'll make all that stuff, and then we'll give that.
Right.
So that fried item is causing, it is not giving anything, but
Yeah.
and in fact it is causing a lot of fats. It is making them fatty, and
Yeah.
that is reason why obesity, metabolic and other metabolic disorders like diabetes, blood pressure, cholesterol is seen in adulthood
Right.
easily because
Right.
of this. Because nutrition is very important, even for children of
Yeah.
one infant to everyone, but infant to teenager, because they are growing like anything.
Exactly.
So nutrition is very important. So including protein in their diet, including fats, good fats in their diet, including vitamin C, iron, selenium, zinc, magnesium, all that stuff food. So potassium and all that. So you get all of it from fruits and
Right.
veggies,
Right.
which which teenagers don't want to eat. So you can try using it in a different way, like
Yeah.
making some healthy stuff for them.
Yeah.
So they'll like it, or be a role model. Like
Yeah.
if you are eating healthy, your child will definitely eat. So your even teenagers will try to eat it. That okay, घर में everyone is eating, so
Yeah.
we have to eat it. It's like that.
Right. Right.
So you can do that. So everything should be balanced, and everything should go. Especially fruits per day, there should be 2 servings of fruits.
Okay.
Veggies, green veggies, then red veggies, that is red capsicum, bell peppers, tomatoes. All of that stuff should be regular. Carrot, then
Okay.
beet, spinach. All these are very important things which should every 2 or 3 days you should use in your diet
Okay.
for their growth. Proteins are like dals, legumes,
Yeah.
chole, rajma, all that stuff.
Yeah.
All that you can regularly you can include. Moong hai, that is also green moong is also very good for their growth. So all this will help them for a balanced growth. It will fulfill all their nutritional requirements.
Right. So typically everything that has some or the other benefits is needed during this time
Yeah.
session.
Yes. Yes.
All right. All right. So yeah. So coming to a last question. Actually, it's not a question. It's just like something, sort of a message from your side to all the girls or the women who are actually dealing with these changes, and to their parents as well, who are seeing their
Yeah.
young ones going through such changes.
Okay. So basically, I want to give message to the parents only, because girls have nothing to do in this. They are just perfect. They are going through some emotional changes, and their hormones are making them do that. And it is normal. You are perfectly normal. Whatever you're facing, yes, I'll
Yeah.
tell the girls that whatever you're facing, just speak up, tell your friends, communicate it to your parents. Don't think that what is like what they will think. Don't
Yeah.
overthink all of the things. Just
Yeah.
speak whatever you're going through, write it down, tell others. Don't be secretive. That's it. And because you're completely normal.
Yeah.
What is the problem is around you. People around you have the problem, not you. And parents, I will tell that listen to your child. They are not rebellious. They are going through something. So just stand with
Right.
them, be with them. Consult a doctor if you don't know. Then it is better to consult a pediatrician or a homeopath or any other doctor, whichever you know, or your family doctor whom you can trust.
It has gone. Yeah.
So they'll guide you actually. They'll guide you. But ultimately, you have to only do things and you have to stand for your children. That's it. So let them explore and let them grow, and just don't control them. That is the thing.
Wonderful, wonderful. So, Dr. Krina, I have one question. Like from all the conversation, what I have understood that puberty in girls is way complex than as compared to boys. So, is it so? All
Yeah,
right.
definitely it is. It is because a lot of things, boys don't go through so much things like girls, because our main problem is the hormone estrogen,
Yeah,
which
yeah,
is causing all of these things.
yeah,
So apart from that, there are a lot of social things which I'm saying now, that girls ko ye, you have to follow this. Girls have
exactly.
to behave in this way.
Yeah,
Girls, so that is the basic problem which is causing the mental health problem, emotional changes,
yeah,
which increases actually. If there
ex-
is a proper atmosphere, environment, you will not face this much thing.
yeah,
Which, if it is not there, this good
yeah,
environment, and 90% you will not see this.
yeah,
Even if there is severe pain, that is menstrual pain, you can see in teenagers. It is very common
yeah.
because so that is at that time also there is no support to them. People
Right.
are like they are going to, she's just doing drama. It is nothing like that. So what, we were also facing this. So
Yeah,
it happens like this. So that is wrong. You should not tell or behave like that. Instead, give a warmth to your child. She is still a child only. Just because she has got periods doesn't mean she will be matured overnight.
yeah. Like
She
she's
is a
in the
child.
process. Yeah,
Yeah, so but boys में क्या होता है? Boys have a different type of growth. They have different and our again the social culture says that boys को सब freedom है. They can do anything.
yeah.
So that is the main reason which has made boys also audacious. I'll be feminist now, but but which has made boys also very audacious that we can do anything. So
Yeah,
that even their misbehavior is also seen.
exactly.
So again, boys के जो parents होते हैं, they'll be like, my son is like this. My son, they'll be doing show off, and after puberty, they'll be like, so. And while girls' parents will be, they'll start feeling that now we have to stay low
Yeah.
because it's like they are
Ladki-
doing. So my girl child has entered a puberty. She has done something wrong. She has to behave like this. So
Yeah,
this is the basically it has nothing to do with medical term or anything else. It has just to do with social thing.
yeah.
Psychological also it has nothing to do.
Right.
But social thing is affecting psychology of a girl. That we
Major.
need to change it.
Right.
थोड़ा बहुत रहता है, but then it will not trigger to this level.
Yeah,
If the environment is good, if you are providing proper nurture to your child, then everything will be in control.
definitely, definitely. All right. Yeah, it was wonderful talking to you, Dr. Krina. I mean, we were
I can't hear
actually
you.
sorry. Can you hear me now?
I can't hear you.
Okay. Uh, can you hear me now?
Okay, no problem.
Can you hear me now?
Yeah.
All right. All right. So I was just saying, yeah, it was wonderful having you, and we actually had a full-fledged conversation, and it was wonderful having you. So thank you so much for being there. Thank you so much for taking
Yeah.
out your time for us, and we shall definitely do this again.
Okay. Bye bye. Thank you. It was a
Thank
nice
you so much.
session.
Yeah,
Yeah.
definitely. Thank you so
Bye.
much. Bye bye.